we've seen a number of alarming reports over the last couple of months since the supervised consumption site in Hamilton was closed about increased rates of emergency response for overdose, including paramedic visits. And what we recently heard from Hamilton Public Health, which is an increased complexity of overdoses. So people experiencing abnormal symptoms, including hallucination, prolonged sedation, and requiring 4 or more doses of naloxone for their overdose to be reversed. This is extremely concerning, and one of the consequences that we anticipated as these life-saving services were to be closed is that we are going to see an increasing complexity of overdose being experienced in the community. We're going to see a rise in the number of overdoses occurring, and there's an increased risk that we're going to see overdose deaths occurring in our community. This alert from public health comes after we've seen more than a doubling in the number of ambulance calls for overdose in Hamilton between March, when the supervised consumption site was closed, and June. So those numbers went from the 40s to 98 EMS calls in 1 month. This is an extremely concerning number, not just in terms of the harms that people are experiencing, but also in terms of the number of healthcare resources that are needing to be deployed to respond to overdoses that could be safely managed in a supervised consumption site. We desperately need a change in policy. We need supervised consumption sites to be reopened, and we need a real strategy to manage the opioid overdose crisis occurring in Ontario.